Good evening, everyone. Good evening. We are going to get started. Please come on in, find a seat. There are plenty here in the front. Very good evening to all of you. There are plenty of seats here in the front. Please join us. Come to the front. We are about to get started. Welcome. Please come in. My name is Raj Kumar. I am the president and editor-in-chief of DevX. It's an honor to be doing this once again with all of you. Welcome to the Every Woman, Every Child high-level reception. Every year, we come together here to push ourselves forward in solidarity. I love the energy that is in the room today. It is needed. Welcome. Please come in, all of you. We are about to get started officially. I want to remind everyone here today of the importance of Every Woman, Every Child and of all of your work. The movements that we are leading matter. The UHC declaration that was just put forward yesterday was not inevitable. The Sustainable Development Goals were not inevitable. They may not have happened without the leadership of so many in this room. And that solidarity is important. That's why we're here. It is also essential, and all of you know this, that we cannot forget children and women and adolescents when we think about achieving those SDGs. They are essential to that. And that is why we're here in a festive atmosphere, yes, to celebrate our successes, but to remember how difficult the road ahead will be and how much we need to pull together. So I want to begin by asking for some opening and welcoming remarks from Her Excellency, the President of Estonia, Ms. Kersti Kaljulaid, who is the co-chair of the high-level steering group here for EWEC. Please, Madam President.
Thank you all for being here, and thank you indeed for the years and years of hard work which you have spent in making sure that women and children globally will be protected, that the voice of women and children will be heard in conflict, in more peaceful times, and also participating, getting the countries out of the conflict and moving towards these more peaceful times. Yes, we know there are still diseases which we could avoid through vaccination. Yes, we know that there are still millions of maternal deaths every year because of the lack of the universal health care. 3 million lives at least could be saved every year if we could deliver universal health care for everybody. But we have also seen progress, and without setting us the objectives and the aims, we couldn't have seen that kind of progress. Life is getting longer for women as well globally. This is important. Children are going to school more than they were before. This is important. And this doesn't happen only if we globally get more resources at our hands. It very much depends on how we distribute, how we think about spending these resources which we have. Because helping women, helping children does not happen all by itself. I was just talking about the megatrends globally, and one of the biggest trends globally obviously is looking for technology to solve all of our problems. And this is true, technology can do a lot. Girls are demanding to be educated, understanding that they can have access to the best of education online. What does that mean? That means, of course, that we need to provide green energy through microgrids and internet connection to these girls. If we have provided them with education, they would seek work. Where would they seek the work? Online. They can work globally online. And now here things get difficult. What will we do with our globally educated and globally working women who are children today, but who already know what they want to do? How will we provide for universal health care for them? Remember, they will be working globally. Who is responsible? The country where they sit in or the country where they work? But they may work in many countries. So how do we provide for their healthcare, for the children they will have, for their education? We need not only to see how technology will work for us, but we also need to see how this technology globally changes what we have been seeking to provide for our people. This is important to think well ahead, because otherwise we will find ourselves in the situation where, yes, we have provided for education and work, yes, we have provided for connection, people know what can be done for their children, for their health, but we cannot provide it because nobody is responsible anymore for women and children working globally. From one side, we are getting out of the old problems, but on the other hand, we are getting into the new problems. Therefore, I would invite you all, indeed, to continue what we have been discussing for years and years. Reproductive health, the right of women to control their own reproductive health, the right of women and girls to live healthily without the threat of female genital mutilation, for example, the right of women and children to speak up in the conflicts, the right of children to get out of the conflict knowing other professions than being a soldier. But these are problems of today. They will be compounded with the new problems. And the sad thing is, if we only see these hopeful eyes of these girls who say, yes, we can use new things to have a better life, and then we fail to deal with the side issues like, yes, you are smart, and we enjoy that you are smart, and we allow you to work, and we somewhere benefit from your work. But we do not think back how your country now can deliver for you, for your healthcare, and for your children's education. This is the new risk added on top of the old risks. And this is what I wanted to tell you. I'm so happy what we have achieved, and I'm quite sure that we'll catch up where we are lagging right now behind in fulfilling our sustainable development goals. But I see also things on the horizon, and I really want to invite you also tonight and in the future to be prepared, to be ready for the future, and to continue thinking also in these terms, that while we are solving with technology every problem nowadays, we need also to think how this technology makes our societies to change, and that we need to adapt also everything we do in healthcare, everything we do in education to these changed, disrupted societies, because technology is a huge disruption. And in previous transformations from one technology to another, like from agriculture to industry, very often women and children, we couldn't say they didn't have opportunity, that they couldn't work and they couldn't develop. Yes, they could, but their healthcare needs and their needs for education, they were neglected. Let's not let this happen in this new digital area of 21st century. Thank you for listening.
Thank you very much, Madam President. Thank you for giving us a vision toward 2030, the technology and industrial and labor force changes that will certainly affect our ability to achieve those goals. So we do need to always be looking forward. I want to mention that the UN General Assembly Week has exploded in interest and attention, and there are celebrity sightings everywhere. Some of that celebrity is given, and some of it is earned. I'd like to ask Deputy Secretary General Amina Mohammed, who has been the architect of these goals that I stand in front of, the godmother of them, the warrior for them, to come forward and give us her opening remarks.
Thank you very much. It's a real pleasure to be with you, and it's so tough these days. As you've seen, the president has just had to leave, and that's because our GA week has become one of speed dating. And the WHO DG just said, would that mean I'm his girlfriend for the next day or two? Yes, we're speed dating. But thank you very much. This is always an incredible crowd, and I'm glad that we've got many more people every year. And over the past 30 years, we've been through Every Woman, Every Child 1.0, 2.0. We added more onto it. And it's amazing. Together, we're gaining more. And we saw in the Women Deliver conference this year the huge momentum that has gathered around trying to bring an end to many of the challenges that we have. My great team, as we started to say, what are we going to say today that's going to be different than we've said in the last few years? Because I think some of it's worth saying, and the rest of it, if we're still saying it, there's something wrong, we haven't moved. Really 4 key messages. 1, we know the tragic state of play today. 2, the UN is responding under the UHC umbrella. 3, that every woman, every child is an innovation at work, and it's continuously evolving. And that 4, we join forces, as the Secretary General declared, the Decade of Action, because since 2015, we're now in 2019. And frankly, we've seen lots of engagement. But where are the results that there are so many people expecting on a day-to-day basis? It's not a theoretical exercise, very much what you do on the ground with hundreds and millions of people. So I think it's worth repeating that we have a maternal mortality that has decreased by 44%. Often we don't look at the good news because we've still got is it half empty or half full, the glass? And I think we should talk about the half full so we can fill the empty piece with some enthusiasm and momentum. It doesn't depress us, because what we really have to do is give hope to people that we are moving in the right direction. I think the figures say that we are. So child mortality too, declining by more than half. The disparities remain. 99% of all maternal deaths occur in developing countries, and that in itself is tragic. Children in sub-Saharan Africa 15 times more likely to die before the age of 5 than children in high-income countries. And with a global agenda, this of course now makes it so much more not acceptable. We're connected, we're one global village. We cannot have these kind of inequalities. Leading cause of death for 15 to 19-year-olds is complications from pregnancy and childbirth, with the vast majority of these deaths in low and middle-income countries. In fact, as I talked to an expert in my country some years ago on VVF, and he said, if you just give women health care, you wouldn't hear about VVF so much. And that's one side of the story, because I think, clearly there is also the cultural side as well, and child marriage has to end. These numbers are underscoring the imperative of achieving our health targets by 2030 if we're to keep our promise of leaving no one behind. So we must know where those no ones are, and data is going to be critical to that. So that, I think, is another big state of play. We don't have the data to tell us where everyone is, and we need to have much better disaggregated data. The response is my second point, and I know Dr. Tedros will talk about that, and it is about the universal health coverage. It's fantastic it's on the agenda now, because it was always relegated to the background as something really difficult to do. It is one of the first things that a country owes its people as a right. It's not an addition, it's not charity, it's not for people to be grateful for. Health coverage is a right for everyone within the borders of that country, and across them if they so come into yours. And I think it's great that we're having that opportunity to discuss that. The first high-level meeting that occurred, and we saw lots of attention put on to universal health coverage from our ministers. There's still a few areas they didn't pick up, and I think yesterday night I mentioned it. I still feel rather disappointed that we're not getting any traction on mental health, because it happens in this constituency as well, as we look at our mothers and our children that are marrying and having babies far too early. So it is important to look at that basic package of primary health care that we can avoid more than 3 million deaths amongst women and children every year. Again, it's going to depend on the political commitment and adequate financing. And here I think the SDG Global Plan is going to work for us, and I'm not going to take what Dr. Tedros is going to say. But I will underscore now the third point, every woman, every child. This is an amazing union of different people and constituencies, passions and commitments and experiences that you've all had. And it does evolve, it's live, and so it's very responsive and has to be much more so as we look at the scale of the things that we have to do. Demographics are not on our side. Rights are not on our side. So it makes it even more challenging, and even more that we have to work at on the ground level with our partnerships and with the countries, as well as our agencies. With the new response that the UN wants to have, with its country teams being much more available, convening, facilitating, leveraging, we hope that you'll see a better partnership from us on the ground. And so for us, the financing facility, the strategy that we have for every woman, every child, can we, like all the frameworks we have, further operationalize and treat it with the urgency that it delivers? Still a long way to go, but all possible. last and not least, the decade of action. It's about delivering results. It's about delivering the SDGs and not just seeing the health goal as one on its own, but how it is the docking station for all the others. When someone talks about the lack of rights for our women and our girls, yes, it is about gender 5, but there you go. It's linked to our health goal, our education goal. It's linked to the economy. It's linked to climate. So just trying, as we get out of the silos and work across, I think also, too, we have to think about the goals in an integrated way, even though the entry point for us would be health. So thank you so much for being together with us again, and I really look forward to hearing the outcomes of this meeting and how the UN can help do much better than it has done in the last decade going into the next, and thanking our H6 for being the anchor on that, particularly UNFPA, where are you, holding this down. Thank you so much. Bye.
Thank you so much, Amina, and for your continued perseverance on the SDGs and the UEC agenda. I do want to ask Mr. Aksel Jacobsen, who is the Secretary for International Development, the State Secretary of International Development for Norway, one of the hosts of this evening's event, to please join us on stage.
Honorable Ministers, UN Deputy Secretary General Amina Mohammed, honorable co-chairs and members of the high-level steering group, and dear all, it is wonderful to see so many people here tonight in this exceptional environment. We are here because we have a common vision and a common mission. We strongly believe that every woman and every child's health matters. It matters for many reasons. Health is a human right issue. It is a human right for every woman and every child to have access to essential health services, and also reproductive health and rights. At the heart of the 2030 Agenda stands the commitment to leaving no one behind. At the high-level political forum in July, the Secretary General reflected on what he called the inclusion imperative. That is also a leading principle in Norway's international development policies. And that's why we are not talking about women and children. We are talking about every woman and every child. Friends, we have seen remarkable progress for sexual and reproductive health and rights over the past 25 years. But we now find ourselves in a situation where the groundbreaking achievements from '94 are under attack. Former allies have changed positions. We are spending time and resources trying to protect the agenda we agreed on 25 years ago instead of making further advances. We must stand firm, defend and protect established rights, and win new allies, and push back the pushback. And this is not only about big politics. This is about the lives, the health, and the well-being of persons all around the world. When the Every Woman, Every Child initiative was launched in 2010, we supported that initiative wholeheartedly, including financially. We honor UN Secretary General Guterres and Deputy Secretary General Mohammed for sustained leadership, spearheading Every Woman, Every Child movement. For initiatives and policies to make a real difference, they should be followed by financial resources. The Global Financing Facility for Women's and Children's and Adolescents' Health, the GFF, is a mechanism that supports countries' own efforts to achieve universal health coverage, with a particular focus on reaching women, children, and adolescents who are left behind. I would take this opportunity to remind you that the replenishment process is still going on. The goal of $2 billion has still not been reached. I believe that every woman, every child, its partners, and its financing mechanism, the GFF, have an important role in achieving universal health coverage. This is important, as universal coverage is the best way to bring health and well-being to all women and children. Dear friends and partners, I sincerely thank you for contributing to this collective effort and success. Our mission is not accomplished. We have unfinished business. By being here tonight, you reconfirm your commitment to our common vision and mission. I thank you.
Thank you so much, Secretary Jakobsen. So it's important to remember before our next speaker makes his way to the stage that the UHC declaration was not inevitable. And frankly, the idea of universal health coverage is still a radical one. When I first met Dr. Tedros Adhanom and he told me this will be my agenda as DG of the WHO, I and many others, I think, thought that's a radical agenda. Will he really be able to pull it off? It is incredible to be able to see the progress made today. I'd like to hear your thoughts. Dr. Tedros, please.
Thank you, Raj. Thank you for that kind introduction. Please, there is a seat. Excellencies, my brothers and sisters, colleagues and friends, thank you for the invitation to speak to you today. And I'm glad I could be here at least for a short while. I think you will agree that yesterday was a landmark day in the history of public health. The political declaration on universal health coverage is a major step forward towards the healthier, safer, fairer world we all want to see. Each of the H6 agencies has an important role to play in supporting countries to make this vision a reality. But to do that, it's essential that we work together in a harmonized way. We all have different mandates and different strengths, but we must also acknowledge that too often in the past, our work has been fragmented or overlapping. This doesn't help countries, and it's not an effective use of donor money. That's why the Global Action Plan on Healthy Lives and Well-being launched today is so important. The 12 multilateral agencies, including each of the H6, are coming together to leverage our collective strengths. Together, we have agreed to align, accelerate, and account. We will align priorities, collaborate to accelerate progress, and account for results we deliver. Frankly, we should have done this long time ago. It also allows us to build synergies resulting in more impact than if we worked alone. One of the key areas in which we will work together is on primary health care. At the high-level meeting yesterday, country after country affirmed that primary health care is foundational to achieving our vision of health for all. But every country's situation is unique, and every country's journey is unique. So a crucial part of our work must be a strategic policy dialogue to support countries to make the right choices and maximize the impact of their health spending. As part of WHO's transformation, we're creating a new strategic policy dialogue process to enable us to engage with countries in a much more strategic and systematic way. We have to support countries to identify what their essential package of services should include based on their own health priorities and finances. ensuring services for women, children, and adolescents, including for sexual and reproductive health and rights and gender equality. Dear friends, we have reached a new milestone in our journey towards universal health coverage. But it's only a milestone. We still have a long road to travel. Time is short, and we have a lot of work to do. None of us can succeed alone, but together we can change the course of history for every woman and every child. Thank you so much.
Thank you, Dr. Tedros. We are going to continue with our program. I want to ask our next panelists to come forward. We're going to have a fireside chat here. Her Excellency, Ms. Hala Zaid, is here, the Minister of Health and Population of Egypt. Please join me. Please, you may clap. I'll just ask you to take the second chair there. Microphone, thank you. Let's see, we have Aynur Aikpakanova, who is the General Director in Kazakhstan of the Health Agency there. Please take the next seat. Thank you. And Ms. Batul Al-Wahadani, who is the President of the International Federation of Medical Students Associations and a youth representative. Thank you so much for joining us here. We heard from Dr. Tedros about the importance of primary health care. And I thought we might start, Minister, with the case of Egypt and the 100 Million Healthy Lives campaign that you've launched there. First of all, tell us, what is that campaign and why is it an example of the importance of focusing on primary health care? Just speak.
Thank you. Thank you very much for inviting me for this unique panel and unique session. Actually, Egypt was 100 million population, and under the campaign of or presidential initiative 100 Million Healthy Lives campaign, we started a huge public health initiatives. We targeted a lot of small initiatives. The largest one was to eliminate Egypt from hepatitis C. As you know, Egypt was the first country worldwide in the high prevalence in hepatitis C, and also for early detection and treatment of non-communicable disease. So we started the campaign and we finished the campaign and we screened more than 60 millions in 7 months.
Did everybody hear that? I just want to make sure you understand the importance of this. 60 million people were screened. In how long?
Screened in 7 months.
For hepatitis C.
From hepatitis C and non-communicable diseases. And also, we started, parallel to this campaign, screening campaign for screening and treatment for children from 6 to 12 years old, 10 millions. From anemia, stunting, and obesity. And we started from 2 months ago one of the initiatives for women's health campaign. We're targeting 28 million female or women in Egypt annually from 18 years old plus.
And I understand one of the ways you were able to do this so quickly is to use technology in a new transformative way. How did you do that? Very briefly, give us a sense of how you did it.
Yes. Without diagnostic technology, affordable diagnostic, and also without medicines, and this is technology also, without IT solutions, we couldn't achieve this dream, and without partnership, as Dr. Tedros mentioned from a few minutes ago. Together we can achieve. Alone we couldn't. So with support from WHO, with support from World Bank, with support from a lot of organizations, we achieved, and we now, Egypt, about to announce that Egypt eliminated from virus C, and we screened 70 millions 10 children, 60 millions from 12 to plus years in 7 months. And now we are working to screen the female or the women from the most problem or diseases that can attack females, like breast cancer, cervical cancer, osteoporosis, non-communicable diseases, as well as reproductive health challenges. So this is a public health initiative. We in Egypt decide to start serious steps towards universal health coverage. We cannot work with a burden of diseases in high population, so we need to start firstly the public health initiatives to eliminate Egypt and to make sure that our generations are healthy. As I mentioned, as I told many times for my colleagues, we are Ministry of Health, not Ministry of Diseases, so we need to keep people healthy. So to implement universal health coverage and with support from WHO, also we started our serious steps towards the universal health coverage. But before this, we achieved screening campaigns. I think one of the largest screening campaigns worldwide with high technology, high technology in diagnosis and treatment, and also software solutions.
Thank you so much, Minister. You know, many people remain skeptical about our ability to achieve the Sustainable Development Goals, and for good reason when you hear the statistics. But those results are not only remarkable, it's remarkable how quickly you got to them. So congratulations on that. Thank you for bringing that message here to this reception. I'd like to move to Aynur from the government of Kazakhstan. Kazakhstan has clearly played a historic role when it comes to primary health coverage. So tell us about your efforts there to deliver an essential package of PHC to your population.
Thank you. As Special Envoy of Minister of Healthcare, His Excellency Dr. Bertanov, I'm here to share thankfulness to all member states, including Government of Norway, and other important stakeholders for organizing this event. And as a home place, birthplace of both declarations on primary healthcare, the 1978 legendary Almaty, as well as the recently, 40 years after Astana Declaration, we thought that we should start from home. So historically, for 4 decades, primary healthcare has been a central and prioritized area of domestic policy. But recently, we have completely redesigned health delivery system. So President of Kazakhstan this year, he announced that 60% of all healthcare expenditure should go to public health and primary healthcare by year 2024. Because typically, more than half of money goes to inpatient tertiary care or expensive secondary care. And so that switching gears and spending more money on PHC, but also very actionable, concrete primary healthcare plan of actions approved by Prime Minister of Kazakhstan this year in June, gives us very concrete steps to implement at all levels, horizontally and vertically. So historically, instead of having a separate tuberculosis treatment hospital, a separate infectious disease hospital, a separate children's hospital, separate maternity houses, we're now integrating them all with primary health care, so that primary health is really the full spectrum of services as declared in the Astana Declaration, including reproductive and sexual health services, access to them, and also the vertical integration with other healthcare organizations and cross-sectoral. This year we had a very high attention national tragedy when 5 young girls burned at night in a house because that home, poor family, was heating with unsafe equipment. And so that fire took away lives of 5 baby girls, and that created such national momentum that President initiated a very vast, sweeping policy changes, improvement of access of women and children, not only to healthcare, but across all sectors, improving welfare schemes. Where the government found out that access to those services was so complicated and bureaucratic. So really it is this revived attention to the state of women and children in Kazakhstan at highest possible level, at president's state of country's head of state level, has generated this new intention, because we always had access, universal access to basic services, including primary health care to entire population. But now looking into it from beyond silos of each different ministry, and with the new state health development program for years 2025, we're going to go beyond health goals and health targets for health system. We're working together with Minister of Labor and Social Affairs, with Minister of Finance, Minister of Education, to create a comprehensive spectrum of services, including educational, rehabilitative, social support, and healthcare support, so that our women and children are not lost between agencies, between different offices knocking doors. So really, I think we are working hard to ensure that we do what we promote at home first, but also would like to remind that it is very important that all member states agreed in the Astana Declaration that primary health care is the cornerstone of getting to UHC. And that comprehensive range of services, including promotion, disease detection at early stages, disease management, and rehabilitation and sexual and reproductive services at primary healthcare level, is essential for us, for policymakers, to ensure access to. Thank you.
Thank you very much. Thank you. I know, one reason why we all gather for events like this, of course, we're all committed to these goals and these issues, is to get re-energized around what is possible. And there are a few themes out of what she just remarked that are important and potentially as examples for other countries. Many countries face the issue of spending too much on tertiary and secondary care compared to primary. The idea that you would be able to switch that balance in a short period of time is a real example. And the integrated nature of care and the real political commitment around the country to do it quickly is important as well. So many takeaways, I think, for this group of committed people. I want to bring in our next speaker, Batul Al-Watani. You may represent, Batul, more people than some of the heads of state who speak from the stage. You are the president of the International Federation of Medical Students. I believe you have 1.3 million members that you represent all over the world in 123 countries. Tell us what you are thinking when you come to an event like this and you see an issue like the UHC. What should we all take away from you and the medical students of this world?
I mean, what is the most important thing that we need to take in mind as a young person speaking here is the role of young people in the primary healthcare process. We keep going around hearing that young people are change makers, they are the future leaders, or they are able to build resilience for their communities. These are the typical sentences, shining ones we hear in the rooms of New York, Geneva, and we heard in Astana as well. But what we need to keep in mind is the most important role for young people as an equal partner, a stakeholder, and implementer when it comes to primary healthcare. We look around, young people are advocates. They are able to speak on behalf of the needs of their communities, mobilize them, and drive social change. We look around, young people are our health workforce. They are the forefront health workers delivering care for their societies. Young people are innovators coming up with important solutions for the most pressing challenges out there. But the most important role that I want you to keep in mind is that young people are troublemakers. And if we are not on your side, you do not want us on the other side. We are not afraid to bring attention to the neglected areas around us in primary healthcare, whether sexual and reproductive health and rights, women's rights, gender equity, the rights of health workers, or mental health. We are not afraid to hold world leaders and global leaders accountable for their promises and actions. And therefore, if we want to accelerate primary healthcare, we need to join hands with the younger generation. It was a nice gesture in Astana, for the ones who were present there, that the declaration of primary healthcare was handled to the younger generation. And that was a recognition of the important role of young people can bring to the primary healthcare process. But what we need to keep in mind that we need to take this action further. We need to recognize young people as an equal partner. We need to get out from our comfort zones, challenge traditional approaches, and join hands in hands to reach primary healthcare.
Thank you very much for that message, Batul. Please. It's always difficult to challenge a group when the people in this audience have been working so hard on these very issues. But frankly, we all need to be challenged when you think of the scale of the problems in the world. And in the end, we need to be patient-centered. Well, the patients in many of the countries that have the highest burden are very young, and the youth need that voice. So please join me, all of you, in thanking this fantastic Firestarter panel for your contributions today. Thank you. So we now have a section of our program today where we're going to hear a number of rapid-fire commitments, real new announcements being made today, and some recommitments to these issues. And we're going to go through them relatively quickly, but I do ask for your attention because there's some important commitments being made. First, I'd like to ask Her Excellency, Ms. Aissatou Touré, the Vice President of the Republic of Gambia, to please come on stage. Not here. Okay, we will go forward. Ms. Kim Simplis Barrow, the First Lady of Belize and Chair of ESCLAN. Thank you.
Thank you so much, Excellencies, distinguished guests, ladies and gentlemen. In my capacity as Chair of Spouses of CARICOM Leaders Action Network, ESCLAN, I am pleased to announce our commitment to advancing the Every Woman, Every Child global strategy for women's, children's, and adolescent health. First Ladies and spouses of the heads of government of the Caribbean community launched its network in 2017 to tackle issues related to health and well-being of women, adolescents, and children in the Caribbean. As our commitment to advancing the global strategy, ESCLAN will advocate for policy, civil society support, and strategic partnership that will empower women and girls to know their value and ability to reach their full potential, as well as to reduce gender-based violence, HIV/AIDS, cervical cancer, adolescent pregnancy, and bring much-needed awareness to mental health. Specifically, we will combat gender-based violence through legislative reform, psychosocial support to victims, and the inclusion of men and boys in the solution. We will improve access to cervical cancer screening and strengthening infrastructure through promotion and utilization of the HPV vaccine. We will promote the health and well-being of adolescents to reduce adolescent pregnancy and vow to eliminate mother-to-child transmission of HIV in the Caribbean, as well as shine a light on mental health issues. These goals will be achieved through advocacy efforts, public awareness campaigns, and resource mobilization. Thank you.
I know our next speaker is here, Mr. Andrew Morley, the CEO and President of World Vision International. Andrew.
Thank you. Excellencies, my sisters and brothers, colleagues and friends. I'm sure each and every one of us has had a defining moment in our lives. Just a few weeks ago, I had one such moment. I met a Maasai girl face to face in East Africa. I will call her Esther. Esther endured female genital mutilation. She was raped and then forced into marriage. Esther was 8 years old. Esther's story made me cry. I'm actually choking thinking about it now. At World Vision, we're supporting Esther, but instead of realizing her brilliance and God-given potential, Esther's life has been shattered to the core. And it's an atrocity that still is repeated across the world each and every day. Dear friends, this has got to stop. So today, on behalf of World Vision, who's working in over 100 countries, I'm proud to tell you that we are making a commitment. We're making a commitment to every woman and to every child. This is a commitment to the global strategy for maternal, newborn, child and adolescent health and nutrition. I would like to announce today that from now until 2030, World Vision will implement $7 billion of health and nutrition programming. This figure includes $2 billion in fragile contexts, as World Vision refocuses its work on the most vulnerable children, children like Esther. I'm also proud to tell you that a third of this overall funding, almost $2.5 billion, will come from private donors. This is particularly important on the 25th anniversary of ICPD. As a result, we will reach more than 15 million children each year with our Survive and Thrive agenda. Additionally, we will transform the lives of nearly 5 million women. We will also lead a new generation of faith leaders to become community advocates on this very issue. Furthermore, in line with our current global campaign to end violence against children, we continue to increase our efforts to eradicate child marriage, FGM, and gender and sexual-based violence. This year marks the 30th anniversary of the Child Rights Convention. Yet many millions of children like Esther, are still denied those rights. Every child deserves good health. And at World Vision, we will do everything in our power to make that happen. That's my personal promise to you, and it's a promise I will keep. Thank you.
Thank you, Andrew. Ms. Rebecca Marmot, from the Chief Sustainability Officer of Unilever. Rebecca.
Good evening, everyone. I'm from Unilever. We are a global leader in fast-moving consumer goods with 2.5 billion people using our products every day, which is a huge responsibility, but it's also a huge opportunity for us to align our business to the Sustainable Development Goals and make a positive impact on women and children's health. As part of that commitment, we've been committed to empower 5 million women across our value chain by 2020. That means within our own workplace, within our own operations, through our extended supply chain, so thinking about female-led procurement, thinking about the smallholder farmers within our supply chain, and through our brands by helping to challenge deeply entrenched gender stereotypes that are seen in advertising around the world. Part of this commitment also includes promoting safety for women in the communities where we operate. We're the world's biggest tea buyer, and with that scale comes a great deal of responsibility to ensure that women around the world can live and work safely on the tea estates and access healthcare services as and when they need them. We've been working now for a number of years with UN Women to strengthen and improve the safety and resilience programs in Kenya. I'm delighted to announce tonight we're also investing an additional €2 million to roll out and implement this same program in Kenya, Tanzania and Rwanda. We're committed to improve the health and empowerment of women on our tea estates, guaranteeing access to basic healthcare services, family planning, maternal and importantly mental health as well, reaching an additional 70,000 people in and around the estates that we operate. We're delighted and proud to have joined the UN Foundation and other companies to improve the health and empowerment of women working in global supply chains across the world. As we step up, we also call on other businesses and other governments to do the same, so together we can meet the promise to achieve the SDGs by 2030. Thank you.
And our final announcement comes from Mr. Charles Lyons, CHIP, the President and CEO of the Elizabeth Glaser Pediatric AIDS Foundation, on behalf of FP 2020.
Thank you, Raj. Good evening, Excellencies, guests, partners. I am from the Elizabeth Glaser Pediatric AIDS Foundation, and it is clear to us that voluntary family planning is a key component of comprehensive quality care for people living with HIV and at risk of contracting HIV. Family planning and HIV are or should be inextricably linked, and services must reflect this. It is essential that we improve the integration of HIV and family planning and tailor those integrated services for populations that need them most. In 2017, 1.8 million people living with HIV young people living with HIV worldwide, 84% of whom are in sub-Saharan Africa. Recent data show, as I think everyone here knows, high incidence rates in young women. Steps must be taken to prevent new adolescent infections and to protect young people from a potentially disastrous surge among them in HIV and AIDS. Therefore, EGPAF is taking steps. We pledge to support 500 health facilities in Africa to reach at least 500,000 people with family planning methods by the end of 2023. This includes supporting facilities to offer family planning services integrated with HIV services, with HIV service delivery programs, all in close collaboration with country governments. Embedded in this commitment is also a pledge to address the youth challenge head-on with youth leaders and advisors. Out of the 500,000 we intend to reach with services by 2023, half will be under age 25. In addressing the family planning needs of youth across sub-Saharan Africa, EGPAF is working to lay the foundation for an AIDS-free generation. We invite you to join us. Thank you for your attention.
I know this is a very busy week for all of you with much happening, and you've been to a lot of sessions, but I hope you will agree with me that hearing the set of announcements and the scale of the announcements and the breadth of commitments being made, it's worth taking a moment to really thank all of these organizations represented today. Please join me in doing that. I'm very pleased to welcome to the stage Dr. Natalia Kanem, who is, of course, the Executive Director of UNFPA and a friend to this movement. Thank you.
Exciting. Excellencies, colleagues, partners and friends, young people, we are believers. We are passionate when it comes to every woman, every child, every adolescent, everywhere. This is a movement that for nearly 10 years has broken new grounds. And wow, have we seen that with the powerful new commitments today. Mobilizing political leadership, mobilizing thought leadership, bringing resources and attention to issues that can only be solved by strong, innovative partnerships across geographies, across themes, across used-to-be silos. We as EWEC are catalyzing individual and collective action, and it really is about moving the words off the page into the communities with all the beautiful examples that we've heard described. These interventions cannot be piecemeal anymore. We're actually talking about leaving no one behind. We're actually talking about less than 11 years, give me 10. So health and well-being arrive right in our lifetime to women, children, and adolescents. We need a lot more, and we've got to declare this, and there's no shame in working together to make sure that we pull in whoever we've got to in order to make those resources appear. These commitments have been fantastic today, And how are we going to double and triple them? It's true that we have made progress. As UNFPA is 50 years old, we've said at least let us congratulate and celebrate that many more women and children are surviving pregnancy and childbirth today than ever before. Yes. But the latest maternal mortality figures are still alarming, and it's a wake-up call for all of us and for people who may not be here but need to be here to know that a decline in preventable pregnancy and childbirth-related deaths has been so small that I wouldn't even call it significant. And huge inequalities when we look at SDG 10 among and within countries. So how do we invest? What do we do together if we're not there yet? Being serious about these global targets means let us pick up the pace and move forward together. There's an urgency that's commensurate in our ambition. When the Secretary General said, walk the path of ambition, I think EWEC, because we are communities coming together for common purposes and building it into stuff that we may already be doing, we're the example of that ambition. The clock is ticking. We should not constrain our actions and minimize ourselves. We need to be expansive and think about leaving no one behind. The last mile is the hardest, so that means all hands on deck, ingenuity, figuring this out together with harmonized action rather than fragmentation that can slow our pace, and making sure that adolescents are listened to and brought into this equation, making sure that we're doing what women want. Under universal health coverage, congratulations to us all, that umbrella has to be the default response of community and country leadership. Now, second, when we talk about health, and of course I proudly include sexual and reproductive health and rights, this is fundamental. This is fundamental. It's about ensuring health, it's about ensuring well-being, and it is about ensuring dignity, right? So to end sexual and gender-based violence, we're not begging for anything. Every woman, every girl, every boy and man for that matter, full respect, bodily integrity, choice, and rights. This is what we're talking about. And the accountability. Who should be the judge of whether we have delivered quality services? Yes, the person who we aim to serve. We're going to ask her. She's going to tell us when we've done well. Working together works. Teamwork does make the dream work. And that power of partnership that EWEC is using means accelerating. It means zero, not minimally better. So as actors, and it's so wonderful to see the power in this room, thank you for your leadership, for what many of you have been doing over decades, but now we accelerate and we push against 2030 because persons living with disabilities, full and equal, refugees and internally displaced persons, indigenous, young first-time mothers, full respect for you, for all of us. Certainly for people of sexual diversities, full, total respect for each and every one of us who have been historically excluded for whatever reason. These global goals, these agendas, these targets, I believe, are achievable. We've done a lot, and we're going to make our mark. We are going to change the course of history. Yes, it's difficult. Yes, we will have forward movement, and occasionally a step back. But to close, I would like to assure you that when we convene in Nairobi in November, and when we convene for Beijing plus 25, and onward through the course of the decade that's upcoming, the forward movement, the harmonized action, the planning together, and asking the so-called beneficiary, how did we do and how do we improve? This is the accountability loop that EWEC represents. Sincere thanks to those of you who are fulfilling these Commitments. A commitment maker can be an individual. It is also wonderful to see donors put resources to zero. We're moving to zero. The health and well-being of every adolescent, every woman, every child, no matter who you are, no matter where you are. I am so confident that working together, we're going to get this done this time. Thank you very much indeed. Thank you.
Well, like we needed another incentive to be in Nairobi. I think everyone will be there. What a powerful message and messenger. Thank you so much, Dr. Kenham. Let me just try to see if I get this right. EWEC, HLSG, PMNCH. If we did a little quiz, does everybody know what those all mean? There are a lot of acronyms in this space, but we want to talk now at our final closing session here about why those multi-stakeholder partnerships actually matter so much. So please join me in welcoming to the stage three leaders who are going to discuss that with us. Her Excellency, Ms. Tarja Halonen, the former President of Finland and the alternate co-chair of the HLSG. The Honorable Ms. Helen Clark, the former Prime Minister of New Zealand and board chair of PMNCH. Ms. Ann Birgit Albrechtsen, the CEO of Plan International and a member of the HLSG herself. Musical chairs. President Halonen, I want to begin by asking you about the importance of government and these multi-stakeholder partnerships. Many of us are veterans of this week here at UN General Assembly, and we might wonder, why do we do this every year? Why do we stand in the long lines and go through all of this? There's a reason, right? What do we need to do to get the political agenda to push us in the right direction?
Let's start from the United Nations. United Nations is, of course, what are the member countries. But the representatives of the member countries are governments. Governments are those who commit themselves to the agreements, and they have to be also accountable for their own people, to the parliament, but also broader to the people. And that's why I think that it's a good way to see these two sides of responsibilities they have. And so I think that it's also good. I was very happy when I noticed that it's not only health, but well-being of the people. Because health sounds for me, a former lawyer, it's a little bit like a medical. But we all know that well-being, the health is very important. It's a human rights issue. But it's also so that well-being consists many other areas. And that's why I do hope so that governments see also that how important it is to have a cooperation with the different sectors of the society, whether it's concerning food production, whether it's concerning housing, environments, education, and so on. And that's why I think that governments have this benefit that they can try to do that. Coming from one of the Nordic countries, from Finland, so I think that many of us here, we have the feeling that we have this kind of universal health coverage. Yes, but it's not only the duty of the public sector. Of course, they are the main responsible for that. But we need also the many kind of the cooperation, friends. For instance, NGOs. I know some of you who have worked a long time in NGOs. NGOs are very good speaking about what it is really in practice. They are also professional concerning some small specific groups and so on. But also, it has been wonderful to see that corporations, the business community has been here much more progressive what they were years ago. So I think very welcome. And these multi-stakeholders, they all do good work, but they need also somebody to coordinate, and that's why I hope that governments could see their responsibility to invite, to encourage, but also to see this kind of the system that what it is together. And governments can also do very effective cooperation. I know that NGOs do it too, but the Estonian president already spoke very, very warmly when we started this evening that how people are not only one country nowadays, they move over the borders for many, many reasons. And that's one thing more that Tedros from the World Health Organization or the Human Rights Commission, and so they know that countries, the governments are also representing ourselves, and that's another point.
And it feels like today, this is not a nice thing to have, to think about these goals. This is now an imperative that governments should rise or fall based on whether they achieve them, that ensuring that every citizen has access to health, quality health care that they can afford, that doesn't make them bankrupt, that this should be fundamental. And that wave, that imperative that we start to see in the streets can be connected to this higher level multi-stakeholder partnership that might exist at a place like the UN.
Yeah, but of course we demand quite a lot. We say that we request, but I remember when we made these SDGs, and then there was one young lady from Peru, and she said that when we made the Millennium Goals, I remember I thought that just correct, my government has to give this for me. But then with SDGs, she said, now I notice that it's also me. I have to be involved to do this. And I think that SDGs have been, for us, most of us, a good lesson to see that it's really comprehensive. It should be all together doing, otherwise we don't success. But the governments have very big responsibility. They have to do that.
Helen, you are the chair of PMNCH, which is the Partnership for Maternal, Newborn, and Child Health. Where does that fit in to this broader movement around every woman, every child? And what should we take away from that partnership?
I think the partnership's quite an extraordinary coming together of just about any sector that has an interest in women, child and adolescent health. 10 constituencies on the board, ranging across governments, developed and developing, private sector, civil society, health professionals, the foundations, the multilaterals. I mean, the list is long. But if you can get a coalition like that on the same page with the same message, and let's hope we can take that same page, same message all the way to Nairobi, which is such an important anniversary, right? And I want to reinforce what Dr. Tedros said. We shouldn't have to be fighting to defend language from 1994, 25 years ago. We want to move forward on these agendas for women and for our future. So, yeah, getting all the stakeholders on one page, really pushing for the needs of women, children, and adolescents to be at the centre of the universal health coverage agenda is critical. And let's just remember that women, children, and adolescents make up about 70% of the world population. So if we're not meeting their needs, well, universal health coverage is not going to go very far, is it?
Yeah, thank you for that. And you're right, it's in some ways feels like there is a broad coalition. Many people are supporting this, but as Dr. Kenham said, there's also a lot of backward steps in the world when we think of the rights of women and children. And I want to turn to Anne-Brigitte Albertson, who's the CEO of Plan International, because you work on those issues all over the world every day. Where do these multi-stakeholder partnerships kind of fit in at the ground level to the work that you do at Plan?
Yeah, thanks, Raj. And, let's get it out of the alphabet soup and into the refugee camps, where we work in humanitarian settings to break down the silos that exist around the lived reality for an adolescent girl. During crisis, she is experiencing loss of the little rights that were afforded her. The protection systems fundamentally fall apart. Her education falls away, her sexual and reproductive health and rights, her education, everything. And if we don't collaborate and break down the silos, she will not have a hope in hell, really. Partnerships generally also help us to break down other silos. We know that the development and humanitarian sector are still totally siloed. And most of the humanitarian crises in which we work are prolonged. They are not just sudden onset crises. They have been going on for 10, 20 years. And we have to break down those silos, and partnerships like this can do it. We will, in partnership, march towards Nairobi in November with Adolescents to make sure that we continue to claim sexual and reproductive health and rights. But there's also a partnership I just want to call out, and that is the partnership that we have to hold each other to account. Hold each other not just to account for the SDGs, but also for upholding the very best behaviors. When we think of girls and women in crisis, they are often abused. And you know, sometimes they're abused by us. And we have to hold each other to account to make sure that nobody is abused because of our presence. And that's also where partnerships can be used.
It's a very important point that we have to hold ourselves, and I see some people wanting to clap. Please clap for that, please. We have to hold ourselves to the highest of standards. We have an enormous responsibility, both a positive one to get things done, but also to ensure we do no harm in that process. Unfortunately, we all know that is not always the case. As we wrap up, I wonder if there are any final thoughts from all of you that you would like this group to take away as they think about the importance of every woman, every child. President Holland?
I would say that when it was a question about the young people, why the sexual and reproductive health and rights is very important, especially for them. We all know it because they are in that age when they need these rights. They need this primary health care. They need all that help. And that's why let's work together that it will be happy time for them. Thank you.
I think my final comment would be a shout out to the adolescents, who are the missing population in many ways in health services. And yet they have their needs. You know, they want their sexual and reproductive health and rights and information. There are mental health needs. They're also very exposed to non-communicable diseases. But they are very articulate. And what's been exciting to me, moving in the circles around these issues now, is to see how Plan International involves young people. So exciting, so much energy at your events. To see the vibrant constituency of adolescents and youth in the Partnership for Maternal, Newborn and Child Health, to see the young people at Women Deliver. They want to be engaged. They want to have a say about the design of their services. So there is a call to action out on adolescent issues, and a call for a summit to be held, an International Adolescent Summit in 2022. And I think that would be fantastic for really shining a light on their issues, but bringing the young people so much into the conversation.
Thanks, Helen, and thanks for the shout out and the shining the light on the adolescent girl who is so often forgotten. I think just to add to that, meeting her needs and reducing, for example, teenage pregnancy fast and rapidly is doable. Over the last 3 years alone, through a combined effort of comprehensive sexuality education, building leadership skills and voice and agencies for girls themselves, breaking down toxic masculinity and engaging boys and men in the work. In Ecuador, we have in key provinces with indigenous people, with the most marginalized people, reduced teenage pregnancy for girls over 15 by 57%, and by under 15s by 73%. So in a very, very short period of time, we can do it, and we need to work together to do it together.
Please join me in thanking this fantastic panel. And I just want to close this evening by thanking all of you and taking a moment to recognize the work all of you are doing. This is a room where many of you could have been up on stage today. And the reason these events get hosted, and I was honored to be asked to come and help to facilitate it, is that this is an alphabet soup world of aid agencies and UN agencies and NGOs, but we need all of you. And I actually just written a book called The Business of Changing the World, and I spent the last several years studying this industry, meeting many of you, interviewing many of you on the pages of DevEx, as you well know. And we just need to remember this is a $200 billion industry in a way, a mission-driven one, but a big one. And we need to own it. We need to make it fit for purpose. If we want to achieve the Sustainable Development Goals, all of us have that role to play. So this was inspirational to hear all of the successes that are out there, but also all the big challenges that are ahead of us. So please join me in thanking the organizers of this event, the EWEC team that has made this happen, Hemant Dwivedi, who is the executive coordinator of the EWEC Secretariat in particular. I'd like to thank Hemant. I'd like to thank the hosts and all of you, especially, for the work that you do every day and for being here this evening. Thank you. Enjoy the rest of the reception.